Hi everybody, welcome to today's Facebook Live. My name is Dr. Sally Foote. I'm a veterinarian and an animal behaviorist. I have over 35 years in general veterinary practice with a behavior focus, a behavior niche. I provide a lot of education and speaking as well as online courses and less stressful handling for the dog and the cat when in for veterinary care as well as for home care. So today's topic I'm going to talk about is our pandemic puppies, meaning the puppies, dogs who were born between January of 2020 up to about March of 2021. So these are dogs who were born in this year and a quarter time when, as the puppies, were weaned and went to a home, there was a lot of limitation on where these puppies could go out and be socialized, and the veterinary care experience was completely different. We were in curbside care. We could not allow the client to come into the exam room. We had to take the pet away, meet people at the car, take the pet away, the dog away, the puppy away from the owner, provide care in the practice, away from the owner, and then bring the puppy back. It was a typical setup. Now, I know some practices may not have gone completely curbside. Other practices, a lot of people are getting really creative with this. Actually, there's a lot we've learned. I will be presenting a webinar this Sunday for veterinarians and veterinary staff called Lessons Learned from Curbside. It'll be 4 p.m. And if you look at my Facebook page, you'll see past posts about that. I will also have it up on my website. And it will be recorded, and that you can get the Race CE from the recorded session after the event, as well as you'll find the recorded session from that in my shop. But anyway, there were some benefits from curbside care, some things that made it a little bit more difficult. But for our puppies have never, were young puppies between March of 2020 to about now, when clinics are allowing the client to come in the exam room. These puppies have not experienced having their owner in the examination room. And so the experience for the puppy now with the client coming in is going to be different. That makes a difference in the environment, a difference in the space, a difference in the exam for this young dog. And depending on how old the dog is, if the dog is already over 4 months of age, we may see the dog actually anxious at the veterinary practice now because the owner's there, even if the owner is not anxious, because it's a change in the environment. It's a change in the space. Hey, I see some people getting on here. Great to see you. So socialization is not only about a dog meeting people or meeting other dogs. It's really every noise, every movement, every texture, every item, every different environment that they're in, that they experience without fear and they become accustomed to. So let's go back. The 3-month-old puppy that was purchased or adopted back in March of 2020, boom, now we're in curbside care. That client says, I need to bring my puppy in for a checkup and his vaccinations and his deworming, and I've got to stay out in the car. Okay, so they do. And that 3-month-old, 2-month-old, 8 to 12-week-old puppy is in their sensory socialization period, which typically for puppies, they have very little fear, they explore, they will readily accept treats. If there's any struggle during the exam, it's very low or limited for the most part. Those of you who are practicing fear-free and low-stress handling techniques would know, let's give them rewards, let's use the Adaptil, let's make sure the table's covered like this with the pad on it, and the puppy would be calm and relaxed or maybe even enjoy their veterinary visits. But remember, for that puppy, that veterinary visit was 1 assistant and 1 doctor, because many of us had to reduce our number of staff. And so it was a lot of times, I'm the doctor, bring them in, one at a time while I stay in maybe even the treatment area. Maybe you use the exam rooms, but we also limited the physical space we were using in our office. So this puppy did not spend time in the waiting area, spent maybe a limited amount of time because I could get that exam done within 3 minutes, vaccination, deworming, etc., because I wasn't talking to the client. There wasn't as much time spent with me, like in this, let's call it the exam bubble, okay? For the puppy, it may have been very happy and very nice. Okay, so now we go to the clinic's open, if you will, or partially open, and we're going to allow maybe even 1 client, 1 owner in the exam room with the pet, now with the doctor and the tech there to do the exam. For this puppy that was a puppy in March where, I learned all this, but it was all just the two of us in the exam room, very quiet area, no dogs in the waiting room, very few in surgery because we had to reserve our PPE. It's a real quiet environment maybe, efficient exam, everything completely done. The explanation to the client is me talking on the phone, down the hall so the puppy's out of there. Now it's going to be all different. And this puppy is now a year old, maybe slightly more than a year old. And so he's never, even though maybe he's gone in a few times, even neutering, and it was all great at the vet, he never had his owner standing there with him. And that in itself is a change. So with that change, depending on how, it depends on how that owner is acting, it will affect the puppy. If the owner is nervous, if the owner is very chatty, if the owner is pacing around, it will increase the anxiety in this young dog. They're going to feed off the owner. I know a lot of us get that, but it may be kind of surprising to you to be like, wow, he was always like really easy going in here, and now he's panting and he's pacing. What gives? Secondly, if this puppy in this year has tightly bonded to the owner, we may see some mild resource guarding of the owner in an otherwise very friendly, easygoing, well-temperamented dog. You may have never seen this dog when if there was a transfer of the leash, from one handler to another, suddenly lunge up or growl as you step near the handler. No, because the dog's not bonded to the handler. But now with the owner in the exam room, if you step to the owner or hand the owner something and the dog suddenly growls or stares, you're like, what gives? Okay, that's a dog who is now developing resource guarding about the owner, because the owner is a highly valued resource. They feed them, they walk them, they let them out, they do everything. And these dogs have been at home a lot. Maybe they went out on walks, but they didn't, and maybe they went to doggy daycare, but they could not go to PetSmart and Rural King and, get close and petted by lots of people. They were not boarded at lots of places because we couldn't travel. They did not have other dog, pet caregivers coming over. And oftentimes, because the whole family is at home, what happens in most homes, one of the parents is the one who's usually doing all the feeding, walking, etc. And that's the person who the dog's going to become most bonded to. And that's how not only can separation anxiety develop, but resource guarding of the owner. And that's where now when the client's in the exam room, you may see this animal much more anxious or agitated, and it's because the owner is in the room. Okay, a third reason for why is it so different for this dog, now when we're in the exam room, is that if this dog has a conflict with the owner, so in this past year, maybe in training the puppy, old methods of force and, scolding, may have been used, or the puppy grabbed paper and the owner goes over and a little stuffed dog grabs the puppy's mouth and pulls the piece of paper out at home. You don't know this is going on at home, right? It's going on at home. Pulls a piece of paper out, pulls out that fork. You don't want you to swallow the fork. You're going to get really sick. And in doing this, the puppy struggles, and now when the owner goes to reach for the dog, the puppy is nipping and biting at the owner or growling at the owner. And so there's conflict with the owner being near, the owner touching the dog, or if somebody else is touching around the face and the body with the owner close by, because you get that transference of the conflict with the owner with the same trigger of touch. So what can result is now, let's say the owner says, well, let me just show you this on the mouth, and the dog bites the owner, and you're like, whoa, what happened? Well, it's because back at home, that owner was trying to get things out of the puppy's mouth and was nearly getting bitten. But now in the veterinary exam room, there's been more stacking of anxiety because this is a new place and I've never had my owner in here, and now she's touching my mouth, so the puppy goes up to actually biting. So this is what's going to be could be a shocker with adding the owner in the exam room for our pandemic puppies. All right, so what are we going to do? Okay, how are we going to help head this off at the pass? Let's be proactive, not reactive. Let's expect this. Okay, I really feel we should expect this. I've had 2 different behavior consults this week and I'm calling them pandemic puppies, not that they're a puppy now, but they were a young puppy last year. Now they're a year and a half old dog. And one is where the young dog, when the technician had left the room after the exam and things seemed to be okay, when she left the room, the puppy had grabbed an item in the that was on the floor, in the veterinary office. I think it was maybe a piece of paper or something. And when the owner was going to go get this from the puppy's mouth, the puppy growled and darted away, and the owner pursued. And then the owner got bitten by the puppy. So the veterinarian made an immediate, referral, etc. But it was talking to the veterinary staff. They were like, man, this puppy's been good here, etc. So I thought, okay, this is a relationship problem with the owner. The puppy and the owner, there's some anxiety related between the owner and the puppy, some conflict. You guys, the dog really likes, but when we added the owner in the exam room, now this is why it's showing up. And it is a surprise to you. Okay. The second case was of resource guarding the owner. That seems to be what's going on in this case. Dog was fine, but then when the owner now was able to be with the dog in the exam room, the dog, any of the staff members approaching, the dog was growling and lunging up and also reacting when there was that transfer. The owner has the leash and they hand it over to you. That's a big, when you've got owner, we have resource guarding of the owner. If I reach and touch the owner, like they hand me a piece of paper and I take it, that's a very common trigger for the dog to aggress up on me, because it's like I'm touching the owner, I'm getting closer to the owner, that activates that resource guarding. So, okay, let's head it off at the pass. Where we're going to start. First of all, we do need to, I would say June 1st is the hallmark date for a lot of practices to say, okay, we're now going to allow clients in the door. Maybe one client in with the pet instead of the whole family, fine. But we're going to allow clients in the door, which means we're going back to the traditional exam room. Maybe we've got the clients waiting out in the car, so we're not filling up the waiting room. Great. But we're going to talk about in the exam room, when we're all in there. The tiny little 8-foot by 10-foot room. That's how our veterinary practices were commonly designed, to be very efficient for space and, the exam table. So by the time you've got the exam table and the counter and the chairs, it's not much physical room in there, especially if you're adding another human being in there, the owner. Okay, so let's, like I said, being preemptive. Tell your clients right away, do not feed them breakfast or feed them no more than 1/4 of their breakfast. Bring the other 3/4 of their dog food with you in a Ziploc bag, and then you will bring his favorite treats broken up into the size of a piece of a Cheerio, mixed in the bag of the dog food. We want a hungry puppy, because that hunger is going to help be a motivator to take the reward, to positively condition the puppy to the owner in the exam room, no matter how the owner is acting. Because the second point is be preemptive and maybe an empathy statement as to, wow, it's probably like, we're looking forward to having you in the office, and I'm sure you have a lot of maybe questions, and if you do you have any worries or concerns, or if you do, let us know, but we're looking forward to having you here, and we're just going to work our best to keep it all calm because it's all new for your puppy too. I don't know, some graceful way of basically stating, I expect you're going to be a little maybe nervous and you might be a little tense, wondering what's it really like for your puppy at the vet, because you never saw them in the exam room last year. Unless the clinics were doing video chat conferencing, which I hope they were. It's a great opportunity to really start locking into using video call and telemedicine, but I get it. Not everybody did that. Not all clients would accept doing it either. But anyway, just at least find some kind of cute way of saying, yeah, it's all going to be exciting and interesting. He may act a little different because this is the first time we've ever all been together, But we're going to do our best to keep it as low stress as possible for him, like something like that, okay? Because that client may see this puppy acting nervous or suddenly like jumping up and growling because you handed the client a piece of paper and they're going, what was that? I've never seen that before, right? So, and then you could say, this is his nervousness because it's the first time we're all together. And then, so that's being like a little empathetically setting an expectation, okay? Thirdly, all right, so you have that even if they didn't already aggress, but you can tell, he's getting tense, okay? You know me, this is your new wallpaper for your exam rooms, okay? This is a dog one. When I do the cat talk, you'll see my cat ones. But these are going to be on the wall right where you can point to them. And I mean point to them because you're going to say, well, he's up here. So let's try something. would you please just step outside the exam room? Just step out in the hallway, just where he can't see you, but you can hear us. And you could even look through the crack on the door and watch us. So you'll really know what's going on, and you're close enough for him to get a little used to you being here. But let's just try this and see how he's different. When that client steps away and out of the exam room and this young dog is suddenly much better, you either have resource guarding of the owner going on, that conflict with the owner going on, or the owner's behavior affecting the dog. Okay? So dog is much better. You just talk right through the door. Okay, well, he's acting a little more calm, so why don't you stay where you are? Thank you so much. Go ahead and get the job. Then when you're done, you say, you can come back in. And when the client walks in, you are tossing rewards to that dog. Now, always, this comes from my top 5 low stress handling techniques, besides having your handouts where everybody is readily recognizing this and responding to this behavior, you're going to have a good, quick tool like your pheromone spray. You can use a pheromone spray on that puppy, rubbing it underneath the neck, put the bandana on now. I would even, for these new clients walking in the door, just hand it to them and say, put it on him now. I used to call Adaptil my happy dog insurance. And so even if the puppy's acting fine, why take a risk on them getting stressed? Say it's like a gift, like a happy first day in the office gift. I don't know, something cute, something creative, but this is going to help to prevent a lot of problems, and especially if you see some of the brewing anxiety. And when the client steps out, or maybe it's a few minutes into the appointment, that the puppy is improving, you know it's because of the Adaptil, and now you're going to send a bottle home with the client. You're going to write it on the medical record as part of the handling plan, so you always use it. But when the client steps out, you will have known beforehand. Is that client acting kind of nervous? And now the dog's way better? Okay, it's the client's behavior is most likely why the puppy's agitated. Oh, the client was looking at their phone, ignoring the puppy, cool as a cucumber, and the client left. Okay, so that is either resource guarding of the client, because, you know, the resource is gone, the trigger's gone, or conflict aggression with the client. Now, in conflict aggression with the client, if the client is not actively, you know, reaching for the puppy, verbally correcting the puppy, doing something that would put the puppy into conflict, then we probably have a high conflict situation at home, meaning like using electronic shock collars or a lot of force training. So when that client comes back in, ask a simple question. So what method, exactly how are you, when your puppy messes up, all puppies mess up, right? Assume all puppies are going to have an accident in the house, they're going to overbark, they're going to do something naughty. When your puppy's naughty, make it a simple question. When your puppy is naughty, what do you do? Now, if they say, oh, I just correct him, okay, and how? Not too stern, but and how? Straight face, right? And if they say, well, you know, I smack him on the butt, I smack him across the face, we've got, you know, that wonderful little ultrasonic collar, okay, this is why he has a conflict aggression. But if the client doesn't say any of those things and says, well, you know, I try to just get him away or see what the problem was, then if there's no strong evidence of conflict aggression with a client who's ignoring the puppy, then that is more about the resource guarding, that this puppy is highly bonded to this owner, and removing the resource, the owner, is why this animal is better. So in that case, refer to a behaviorist, okay? It can be very, it's not complicated, but you have to get the full history, and you have to see inside the home and exactly where this puppy is sleeping and laying, etc., that bond has built so strongly to then now go over into resource guarding. But make a note on the record that we're going to ask the client to leave when they come to bring the dog in. And then there are techniques for how we do the handoff of the leash. That's in my advanced low stress handling courses that I teach. I can't cover this right now, but just keep in mind, now you know which category you're in with this puppy, and you have a response for it. Okay. So those are some of the big reasons why a puppy may act up. The fourth, another cause, what else has changed in your practice space? Now that you have, let's just say, opened the doors, as compared to when you were curbside, have you been able to increase the number of appointments you're seeing per hour? Increased the number of staffing people that are in your exam rooms, in the hallways, in the waiting area? Are you, having people wait in the waiting area as compared to waiting out in the car. In other words, have these spaces and areas of your clinic become more noisy, more noise and more people with movement, because it's noise and movement that are two really big triggers for the dog. The third one is another dog's behavior. If you have another dog in the waiting room barking, or in the back barking and whining, that's going to agitate, this puppy. So I think it is a good idea, as much as we can, to have the client stay in the car with their dog and escort them into the exam room with the client, provided that the animal goes with the client really well. Anyway, for the exam, and then escort them out and utilize things still like our online checkout process with invoicing, etc., but at least minimizing wait time in the waiting room, and utilize the client's car. Summer is coming. It's going to be very hot. Gas prices have increased, so running the air conditioning on a running car might be like, oh, not good. And those of you who work and live in very urban areas like New York City and in Chicago and in the city of Los Angeles, people may not be using a car to bring their pets in. They may be coming in on public transportation, so you're going to need to have some kind of a waiting area. And in that case, then, we might be a little more creative in opening up other rooms to be exam rooms to get them out of that waiting room, or partitioning the waiting room in ways kind of creatively, with room dividers, or short bookcases or something like that. But good luck to you all with the pandemic puppies. I do have a couple of puppy courses that are available through my website, Dr. Sally J. Foote, to help you not only understand about puppy behavior, but have some syllabuses for puppy consults to help these young dogs. These young dogs have really had it's a wonderful year that they had at home with their owners, a lot of attention and a lot of, bonding with the family. Yet, as we all have been predicting, separation anxiety is only one of the many behavior concerns that are popping up with these pandemic puppies. So my Better Bond, Better Behavior puppy certification course, I show on that how to do the low-stress puppy exam, managing and controlling impulsivity. It does have the syllabus for running puppy classes. You could still do puppy classes with dogs up to a year of age. It's going to be done differently. I have an older puppy class syllabus for a 4-week course in this program, as well as for the young puppy. But then also how to do half-hour puppy consults to nip these problems in the bud with your client. I also have a 2-hour online, so this is for the client, housebound puppy socialization course. So even if they cannot get into a puppy class, they still can follow how to socialize an older dog using their meal, following the Learn to Earn as Dr. Sophia Yin had presented it, along with other resources. I look forward to hearing your comments on the bottom, especially those of you who are in practice or in some of the shelter clinics, shelter vaccination clinics, that are now starting to see these young dogs with their owners present, and what kinds of behaviors and things you're seeing, especially if there's a difference when you saw that puppy 6 months ago as curbside versus now. We're going to move forward as our world moves forward, and we're going to take some of the good from curbside along with what we return to traditional exams, and I look forward to this. I hope you can join me this Sunday at my webinar. Just go ahead and follow the links on the YouTube channel and follow the post below on Facebook, and I'll have the registration link. And take care and stay healthy. Bye-bye.